Hello, today I'm going to be doing a mock demonstration of intravenous administration. And just to start off right off the bat, I just want to say that the RN would be wearing gloves and would have already washed their hands prior to this process, but for the sake of this, because I'm not actually doing it, I will not be wearing gloves. So to begin, the RN would begin by priming everything and making sure that everything is sterile. So to do that, she would take the saline lock, and to prime it, she would take this syringe flush and she would insert it like this, and then just give it a little gentle push to get all of the air out, and you know that the air is out because you will see fluids coming out. So now that will be put off to the side. The RN can move forward, and to do this, she would apply a tourniquet after picking a vein. Typically this will be on the arm because it is easy to access and close to the heart, which is important because that ensures that whatever medication or fluids is given will be pumped into the bloodstream quicker. So now the tourniquet would be applied, and this needs to be applied tightly so that the circulation is temporarily cut off to ensure that blood doesn't squirt everywhere, and it makes the veins easier to see so the RN will not be going into this blind. Now the RN would sterilize the skin with this sterile sponge, and then they would take the angiocath needle and prepare to insert that into the vein. So once the angiocath needle is inserted, the catheter, which is this part, would be inside of the vein, and then this part is sticking out. So that is there, and then now this saline lock can be attached to that, like this. Then once that is applied, you can use the transparent dressing to secure the IV line. And then now that that's secured, the RN will begin to prime the IV fluid bag. And to do that, all that has to be done is the IV line right here will be attached. This will be attached to this little section right here, and the RN will puncture the bag and then begin priming it. And it is important to prime to ensure that there is no air in the bloodstream, because if air is in the bloodstream, that can cause serious complications such as difficulty breathing. So to begin the priming, all the RN would do is release this safety clamp, and once that is released, you would start to see fluid dripping down into here, and then all the air would be pushed out. So then at this point, the RN would attach this section to the saline lock by pushing it in and then giving it a little twist. And now the patient would be receiving all of the necessary fluids that they need.